Good afternoon and thanks for joining us on News Track, reaching you live from Orefe facility. My name is Yaksat Maklek. President Bola Tinubu has inaugurated the Presidential Working Group on the National Policing Bill to prepare the legal framework for the implementation of the state police across the country, represented by his Chief of Staff, Femi Gbajabiamila. The President inaugurated the committee at the Presidential Villa, Abuja. The inauguration followed the Senate's passage of the Constitution Alteration State Police Bill 2026, which proposes a dual policing structure comprising the Federal Police Service and 36 state police services. Tinubu said that although the constitutional amendment establishes the framework for state police, the National Policing Bill would provide the legal basis for its implementation. He said the proposed legislation would address minimum policing standards, state readiness certification, federal-state coordination, accountability, human rights safeguards, personnel transition, and fiscal requirements. The President stressed that the committee had been constituted to produce a technically sound implementation-ready draft bill for transmission to the National Assembly immediately after the constitutional amendment process. He added that the committee would also recommend other legal instruments required for the smooth implementation of the dual policing system. Gbajabiamila will head the committee, whose members include the Attorney General of the Federation, the National Security Advisor, the Inspector General of Police, the President of the Nigeria Bar Association, the Chairman of the Nigeria Governors Forum, the Chairman of the NGF Committee on State Police, and the committee's secretariat. The Senate has urged the federal government to halt the policy of rehabilitating and reintegrating former Boko Haram members into the society and ensure that the perpetrators of terrorism and banditry are instead arrested and made to face the full wrath of the law. The resolutions followed a motion of urgent national importance of escalating attacks, abductions, and killings of 7 and retired military personnel, sponsored by the Chairman, Senate Committee on Army, Senator Abdulaziz Yaradua, during plenary. The Senate condemned in strong terms the worsening insecurity in Nigeria, describing it as increasingly complex, persistent, and alarming, manifesting through terrorism, insurgency, banditry, kidnapping, attacks on communities, and continued loss of innocent lives across the country. Debate on the issue drew contributions from senators across party lines, reflecting deep concerns within the National Assembly over a security crisis that has in recent years expanded beyond its traditional northeast epicenter to touch virtually every zone of the country. And this happened as the Nigerian Army announced the surrender of 2 senior terrorist commanders to troops of Operation Hatinkai in Borno State, saying the detained suspects have provided valuable intelligence expected to aid ongoing operations against insurgents. The Senate observed a minute of silence in honor of late Major General Rabi Abubakar, former Director of Defense Information, and all Nigerians who lost their lives to terrorism, insurgency, banditry, and kidnapping across the Federation. It resolves that the Senate leadership will immediately constitute a delegation of senators to visit the family of the late general, the Katsina State government, and the Nigerian Army to convey its condolences. The Plateau State House of Assembly has passed a bill to provide financial support and faith-based health institutions across the state. The passage of the bill followed the presentation and adoption of the report of the House Committee on Health during Tuesday's plenary session. The House of Assembly correspondent reports that the plenary was presided over by the Speaker, Nanlong Daniel. The report.
Presenting the committee's report, Deputy Chairman of the House Committee on Health and member representing Lantern North Central Constituency, Daniel Listic, said the committee engaged relevant stakeholders and carefully scrutinized the bill before recommending its passage.
It is hoped that the observations and recommendations made will facilitate the quick passage of this bill.
Following deliberations by lawmakers, Speaker Nanlong Daniel said the passage of the bill will strengthen collaboration between government and the faith-based health institution in providing health care services.
Those in support should say aye. Aye. Those against should say nay. The ayes have it.
Meanwhile, the House also passed the second reading of a bill to establish payment allowance and pensions for former speakers, deputy speakers, principal officers, and members of the Plateau State House of Assembly. The bill, sponsored by a member representing Ruku-Erigwe constituency, Eli Ankala, and other core sponsors, seeks to provide pension benefits for eligible former presiding and principal officers of the Assembly. Also at plenary, the lawmakers passed the second reading of a bill to establish the Plateau State House of Assembly Service Pension Board. Speaking on behalf of the sponsors, Majority Leader and member representing Kanki constituency, Joseph Gokum, said the proposed bill will ensure effective management and guarantee the prompt payment of pensions and gratuities to eligible assembly staff.
And ensure efficient data collection in respect of serving and retired staff of the service.
Still on Tuesday's plenary, a bill seeking to prohibit the use, manufacture, transportation and sale of single-use plastics in Plateau State passed its second reading. Sponsor of the bill, member representing Kwampan North constituency, Chiudu Meyaki, explained that when passed into law, the bill would promote proper waste management and safeguard the environment from public pollution. Member representing Langton North constituency, Nim Chaknansak, moved a motion urging the Plateau State House of Assembly to honor the late Sylvain Musa, a former Second Republic lawmaker who passed away at the age of 92. It's been Simi Cholom.
And still within the confines of the legislature, the Plateau State House of Assembly has restated its commitment to working with the executive arm to address operational challenges facing health institutions across the state. Chairman House Standing Committee on Health, Yakubu Sanda, stated this during an oversight visit to the Plateau State Drugs and Medical Commodities Management Agency. Our House of Assembly correspondent tells us more.
The oversight visit by the House Standing Committee on Health provided an opportunity to assess the agency's first quarter performance, review its operations and identify areas requiring legislative intervention. Chairman of the committee, Yakubu Sanda, commended Governor Caleb Mutfwang for operationalizing the agency and praised its management for the remarkable transformation recorded within a short period. Sanda assured that the committee will thoroughly review the agency's first quarter report and collaborate with the executive arm to address the identified challenges for improved healthcare service delivery.
As we have seen, we are going down to work with the executive to see that these challenges are being surmounted so that the Plateau people will sincerely appreciate what is going on. So far they are appreciating, we are all appreciating. In fact, some of the improvement has even beginning to go down. That the central zone, the southern zone, and the northern zone are going to have their own offices there.
Director General of the Plateau State Drugs and Medical Commodities Management Agency, Kim Jerry Bott, said the agency was established as a non-profit organization and is committed to ensuring the sustainable availability of quality drugs and medical commodities across Plateau State. Kim Jerry Bott has expanded healthcare facility coverage, strengthened partnerships, and improved the state's public health supply chain.
Again, we are looking at a system where by 2030, 2031, we will now be going down into community supply chain management, where patients will be sitting down even in their home and be able to access their medications.
He added that Plateau State has moved from the 26th to 4th position nationally in public health supply chain performance. Highlight of the visit was an inspection tour of the agency's facilities by members of the House Standing Committee on Health. In Jos, I am Akigang.
Meantime, Plateau State Commissioner for Health, Nicholas Pamblong, has called for stronger collaboration amongst government institutions, relevant agencies and other stakeholders to dismantle the supply chain of illicit drugs and harmful substances across the state. The Commissioner made the call at a stakeholders' engagement on the roadmap for disruption of illicit supply chain of drugs and substances in Plateau State. Our correspondent was at the Community and Social Development Agency in Jos and tells us more.
The engagement brought together representatives from government ministries, security and law enforcement agencies, civil society organization, traditional leader, and partners to review and validate strategic actions aimed at dismantling the networks that facilitate the supply chain of illicit drugs and substance in the state. In a keynote address, Commissioner for Health, Dr. Nicholas Bamlong, noted that the supply chain of illicit drugs in the state is becoming a major concern, which requires a strong collaboration from government agencies and stakeholders.
The governor has emphasized this severally. We need to proactively engage people that are supposed to protect the system. Traditional rulers, community leaders, the police, drug law, the churches, the mosque, influencers in society. These are the things that we need to be preaching regularly to our children.
In an overview of drug situations and response in Nigeria and Plateau State, representative of United Nations Office on Drugs and Crime, Hon Praise, said 1 out of 7 Nigerians within the age of 15 are exposed to drugs. She highlights drug supply and demand reduction as global response to solving drug issues.
You agree with me that recently there have been a lot of drugs on our streets, and this is indicative that people are selling drugs. So the supply chain is increasing. It has become problematic.
Other facilitator identifies personal threats and community marginalization as risk factor of drugs abuse. Participants at the event from NDLEA and NAFDAC emphasized that the event will provide coordinated framework that will enhance border and transit monitoring, stronger law enforcement operation, and community-based prevention. In Jos, Rodkan, Nanfa.
Still on health matters, Plateau State Commissioner of Health, Nicholas Bamlong, has called on journalists to intensify public awareness to support the state's malaria elimination efforts. Bamlong made the call at a media parley organized by the State Malaria Elimination Program in collaboration with Malaria Consortium. Our correspondent reports that the event took place at the Crispan Hotel and Suites in Jos.
The media parley brought together stakeholders from the state's malaria elimination program, Plateau State Primary Health Care Board, Malaria Consortium, journalists from different media organizations, among others. According to the state's Commissioner of Health, Nicholas Bamlong, the state's government has invested funds in the elimination of malaria in the state, calling on journalists to amplify government's efforts through accurate and timely reportage.
We want the media to know exactly what is going on in the Plateau. I can tell you that for this particular setting, malaria has actually been going down in Plateau. 18.8% to 2.8%.
Program Manager, State Malaria Elimination Program, Kizito Ndak, noted that it became imperative to engage journalists in order to strengthen engagement and provide updates on ongoing intervention across the state.
In the cycle 1, we were able to reach well over 1 million children. And our target was from the 5 cycles that we have, from June to October, we should be able to maintain that particular tempo, reaching over 1 million children across the 225 wards we have in Plateau State.
Project Manager Malaria Consortium in the state, Dr. Mashor Mboas, noted that the success of seasonal malaria chemo prevention campaigns is the collective responsibility of all stakeholders, especially through community engagement and accurate dissemination of information.
We want to have one-on-one discussion with the media so that whatever media is taking from activities of the malaria elimination program, as it concerns the support coming from Malaria Consortium, it should be captured in context.
The parley featured a question and answer session where newsmen raised concerns affecting the smooth implementation of the program. There were goodwill messages from the Plateau State Primary Health Care Board, Nigerian Medical Association, Civil Society Organization, Pharmacy Council of Nigeria, among others. In Jos, Modesty, Niang Long.
The Plateau State Christian Pilgrims Welfare Board has commenced screening of the second batch of the 2000 and 25 intending pilgrims to the Holy Land. The exercise is holding at the Evangelical Church Winning All headquarters in Jos. Our correspondent has details.